I found out I was HIV positive in 2008 when I went to sell plasma. You see, when you go sell plasma for the first time, they screen you. And, you know, since I had a wonderful experience with it, I decided to go back. However, this time I was met with, "Ma'am, you need to see the doctor." And my first response was, "Why do I need to see the doctor? Isn't this something they could have told me over the phone?" And I started to become upset. Then I thought about it. Due to my practices of using drugs, and even though I was not an intravenous drug user, I did date some. And the fact that I didn't use a condom each and every time I had sex, I knew that this was something they couldn't tell me over the phone. So I decided it would be a good idea to take some support with me. So I talked to my sister, and she decided to come with me. We both sat into the doctor's office, so we sat down. And he began to tell me that I had contracted HIV and hepatitis C. When I heard those words, I began to cry right there in the doctor's office. It broke me down, and I began to cry and cry and cry. And then he proceeded to say that there was a strong chance that I had been living with HIV untreated for 9 years. And then I thought about the time when 5 years ago, I went to the doctor to get tested, but I didn't bother to go back to get the results. So I continued to cry. Then finally I was able to get myself together, go to the car, and make those phone calls, the necessary phone calls that needed to be made. And to be honest, I didn't even want to do it, but I knew it had to be done. And so I went home and depression set in. I found myself sitting down in the dark with the blinds closed. Listening to gospel music was the only thing that helped me to get through. And finally, I gained my strength and decided to do what needed to be done. I got on antidepressant medication, and I started taking my HIV meds. I was doing it faithfully, getting better. Then all of a sudden, 2 months in, I had pneumonia. My body started shutting down, and I had to go to the hospital. And then they told me in the hospital bed that there was a strong chance I wouldn't even be able to walk again, so I may want to consider using a mobility device. I was like, no, not me. I am too young for that. And at that moment, I decided that I would get better. I got better, and I was able to walk out of the hospital. But to be honest, that scared me. And I realized that I needed someone who would be able to take care of me during those times that I just couldn't do it anymore. So I decided to talk to my family, and my children said that they would help me. I took a class on disclosure, and based on the information that they told me, I personally decided I would only disclose to people in the medical field and people I was going to have sex with. Because, you know, I already disclosed to my family. When you look at the word disclosure, it's a powerful word, because disclosure means to open yourself up to judgment. And in my community, the Black community, I feel that there's a stigma attached to HIV. Yes, the literature is out there, it is, but people still stigmatize you and treat you differently. I even had to go through that with my family. My children, they were more active. They decided to take classes and gain knowledge and information. However, in the church community, they were different. I had to hear people say, "Oh, look at them. You know they have it." And they asked, "What is it? Age?" You can look at them. And then the thing is, when you looked at them, all they had was lesions on their necks. And it could have been bad sweat glands or even bad skin. And then I'm like, "You don't know." And they said, "Yeah, I do know. And then in my mind, I thought, you don't know because you're standing next to someone who has full-blown AIDS. And I don't look like it." And my mom, she would do things like, "You know, you don't look well. You don't have to come to church today." I think she felt that if I'm sick, I would make somebody else sick. And the fact of the matter is, that's not true. If I went around somebody and my immune system was low, they would make me sick, not me make them sick. I guess with my mom, she's a Southern Black who didn't even believe in therapy. She believed in prayer. Prayer and faith can get you through anything. She didn't even believe in asking for help. She was the kind of woman who felt that Black women should be strong. No need to ask for help. You can handle it on your own. And even the men in my family, they would take more care of their cars, their apartments, their girlfriends or wives than themselves. No one asks for help, but I have decided I'm going to ask for help. I'm going to get the help I need. And the thing is, I have decided not to focus on my status, not make that the top factor in my life. I'm going to live my life. You see, I was blessed with a granddaughter, and she's my top factor now. She helps me to get through everything I need to get through. You see, I've been blessed to see 55, and to be honest, I didn't think I would make it to 50. And the good thing about my status is, along my journey, I was blessed to meet people who helped me, to walk along with me to help me get through this. When I was first diagnosed, there was a counselor there who saw past my status, and she talked to me because she cared about me. She said, get the information and do what you need to do to get better. And then there was this other lady who was nurse assistant, and she was mean to me. And the first thing I thought is that she don't like me. She's judging me because of my status. But come to find out, she did like me, and that's why she was hard on me. It's because she wanted me to get better. And now that I think about it, when I was first diagnosed, there was a lot of information out there. But now, there isn't a lot of information. People don't want to talk about their status. And my advice to people who have been newly diagnosed, share your stories. Talk about it. Because in talking about it, you will get more people to go get tested, because we know that people don't want to get tested or even wear condoms. And with you sharing your story, you put a face to the disease. And if they see you're living well, they will too. And so I have decided to focus on living my life and getting better. So when you look at me, what you see is someone who may have HIV. However, due to the wonderful care of Louisville Hospital, I am someone who is living and not dying with HIV.